The current flu season is coinciding with, as you know, holiday travel, and of course the ongoing pandemic has the potential to put more vulnerable Iowans at risk for COVID-19. Dr. Daniel Diekema is professor of internal medicine and pathology at the University of Iowa-Carver College of Medicine and a hospital epidemiologist at the University of Iowa Healthcare. He joins me now to talk about ways to stay healthy as this pandemic continues, and especially during this holiday season. Welcome.
Thank you for having me.
This COVID-19 just won't let up. So I understand COVID-19 cases are rising again in Iowa and, of course, across the country. What can people do to avoid getting and spreading COVID-19?
So they can do many of the things that, we've been talking about for, as you point out, 18 months or longer now. Maybe the most important thing right now, I would say, not maybe, but definitely, is to get vaccinated. And if you have been fully vaccinated and it's been more than 6 months since you got your second dose, then you should also get a booster shot. That really is the most effective way to keep you from getting severely ill or needing to be hospitalized or dying from COVID-19. But it also really helps to protect other people because you're both less likely to get the infection and you're less likely to pass it along to someone else. So get vaccinated, vaccinate your kids if they're eligible. That's going to be ultimately the way that we end this pandemic.
Well, I've said many times, I had the Moderna vaccine as soon as I became eligible, and I recently got my booster. But I also noticed, doctor, that people are sort of feeling, well, it's complicated, right? I always wear a mask. So should we still be masked up?
Yeah, I understand the sentiment that you're conveying, that we're all extremely tired of this pandemic and we all want to get past it. And we can't put our lives on hold for 2 years. So I think as we move forward, we need to think about the simple things that we can do to prevent spread and to eventually get on the other side of this pandemic that still allow life to continue. For example, we all know that in-person schooling is critically important. We have to continue to find safe ways to do that. Similarly, going out in public, you're going to be doing that, gathering with people, et cetera, remains extremely important. The best way to protect yourself in those situations is still to wear a mask when you're in indoor spaces in public where there are, people from multiple other households or that you don't know their vaccination status and so forth. So masking does remain a really important part of prevention, despite the fact that absolutely we're all very tired of it. So I still think, getting vaccinated and wearing masks in public indoor spaces remain important things to do, and I do that myself.
Dr. Diekema, can you talk to us about this new variant and give us some more information about how it's transmitted?
Yeah, so yes, we have a new variant. It's important to note that the more people who are vaccinated, the less likely new variants will emerge. And this variant did emerge in a part of the world where vaccination rates were quite low. Well, actually, we don't know where it emerged, but its spread was first detected in South Africa, and vaccination rates there were under 30% overall. So one of the reasons to increase vaccination rates is to decrease the risk that new variants will emerge. We're still learning about this variant, how transmissible it is, whether it's more transmissible than Delta, which is the one that's currently spreading in Iowa, and then also whether it has the ability to evade some of the immune responses induced by vaccination. And some of the early information that we're just getting over the past couple of days is that, yes, this virus does have the ability to evade some of the antibodies that the vaccine induces, but that a booster dose really helps restore protection. So really, if anything, what we're learning about Omicron is that it makes the booster dose even more important. And really anyone, all adults, who've been fully vaccinated and are more than 6 months out from vaccination should get the booster. And those who receive the J&J should get a booster if they're more than 2 months out from their J&J dose.
The vaccine was recently approved and is now available for children ages 5 to 11. What advice would you give to parents who are getting their children vaccinated, or if they're thinking about it?
Yeah. I mean, I would strongly encourage them to do so. I understand why parents might be hesitant, simply because it is true that children are not as severely impacted often by COVID-19 than adults, but they can be severely impacted. And in some cases, they do require hospitalization. And in fact, we're seeing rates of hospitalization among children rising in Iowa and around the country. So getting them vaccinated protects them. And then secondly, and I think equally important, is that children are very important in the transmission of COVID-19 in households and in the community. So by vaccinating your child, you're also protecting the rest of the household, the grandparents, the friends, the aunts, the uncles, all the people that child comes into contact with. So there's a couple of really good reasons to get vaccinated. And in terms of the side effects, we know now from a lot of experience that the side effects and the impact of COVID-19 are much worse than the vaccine. The vaccine has been extremely well tolerated in children, just usually mild symptoms, primarily injection site tenderness, but that's about it.
All right. There are parents who are also concerned that the vaccine, if they give it to their children, could lead to fertility issues down the road. Could you speak to that concern?
Yes, there is no evidence that receiving the COVID-19 vaccine will impact fertility. And we have now a fair bit of evidence that there's just no truth to that suggestion.
So guys, as you know, the vaccines are free and it's easy to make an appointment. What should people do to make an appointment in Iowa, Doctor?
So many of your listeners will already know of locations that are administering the vaccine and either through their doctor's office or through their local pharmacy. But you can also go to vaccines.gov and type in, your location, and it will guide you to locations where you can get vaccinated. As you pointed out, it's free and available, and so it's just critically important as we enter winter and the holiday season and more travel and more gatherings, that you get vaccinated, or if you've been vaccinated and are eligible for a booster, get that booster dose.
What would you say to people who are still hesitant to get the vaccine?
I would just say that the vaccine now, from the beginning of its availability, we have vaccinated, I think, maybe 4 and 5 adults now in the US, over 200 million people who've received this vaccine. And we're monitoring the safety more than probably any vaccine ever in history. So we now have a lot of experience with the safety of this vaccine and also with its effectiveness. And the more we learn, the more we confirm that it's extremely safe and highly effective. So please be careful about the media outlets that you frequent, and please don't become prey to misinformation. The information that's reliable can be found on the CDC and Department of Health and Human Services websites and trusted medical experts, and they all convey the same message. These vaccines are safe, the vaccines are effective, and the vaccines are the ultimate way out of this pandemic and back to a more normal life.
Well, thank you, Dr. Diekema, for joining me on the show today and for being that qualified medical professional who can give us up-to-date and reliable information. I really appreciate all the work that you're doing and wishing all Iowans the very best in this holiday season. Yeah, guys, come on. Let's get rid of this COVID-19. Thanks so much for joining me, Dr. Diekema.
Thank you very much for having me.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information on Talk with Audrey. It's all about the business of living. I'll see you next week.